optimistic on time, but I'll try and do that. Let's see. Yeah, so thanks everybody. As Eva said, I want to talk about the new project that we have funded by the Uppsala Antibiotic Center called Governing AMR Through Distal Drivers, ? So is that a possibility? With distal drivers here, I'll come back to that concept, but that's really about the mechanisms, the causal factors affecting antimicrobial use and antimicrobial resistance that are not sort of through indirect interactions. So not the direct interactions that immediately affect antimicrobial use and resistance, but those that are sort of higher up in the causal chain of events. But we'll come back to that. So I will not only talk about the project today, I actually want to situate it in sort of explain why I think this project is so important, and also situate it in the context of my own ongoing and past work to explain sort of where it fits in. So the outline for my talk today is first to introduce what I think is a new and much needed narrative for dealing with the challenge of antimicrobial resistance. Yeah, I called it Living with Resistance, and that's coming out of a synthesis project from the National Social and Environmental Synthesis Center in the US. And then I will talk about then, for that new narrative to work, a major focus needs to be that we focus on our research on understanding how we can build societal resilience to the challenge of AMR. And I'll give an example from the AMR Resilience Project in terms of how we can increase resilience through learning. And then at the end, I'll explain why this new project fills out a major gap in existing work in terms of understanding. In order to build resilience, actually, it's going to be very important that we can try and govern AMR increasingly through by addressing its distal drivers. So I'll come back to that. So that's the outline. And I think it all starts with understanding the interaction between, or how we can govern AMR through and harmonize it with our existing approaches to sustainable development and all the existing political efforts that are targeting sustainable development. So the Sustainable Development Goals is the major international policy framework today. And I think AMR really needs to have an increasing sort of position within that framework. But there's a problem here, and that's that existing approaches to sustainable development. If we take the Brundtland framework, for example, right, it views environment, society, and economy as sort of three overlapping, but otherwise, they're otherwise fairly independent pillars that we need to target for sustainable development. And so I have a joint position at the Stockholm Resilience Center, and one problem we've identified there is that our past approaches to sustainable development has really been, even though it's been these three pillars on paper, in practice, it's been focusing so much on the economy and the real politics. So economic growth has been the main driver, and environmental sustainability and social equity has been sort of riding along on the side and been less important on that agenda. And actually, I think we can transfer this framework. Yeah, first of all, I don't know if you can see what it looks like, but at the Stockholm Resilience Center, we call this the Mickey Mouse economy, because depending on what picture you put of Mickey Mouse, it looks a bit like that actually. So we need to move away from that in general. But I think we can also apply this thinking in AMR, where we have these three major pillars of innovation, access, and conservation, which could be the model for sustainable development, a sustainable development approach to antimicrobial resistance. But I think in the past, we've seen the same major problem, right? That's why we ended up in this crisis of AMR, is that we focus so much on innovation and less on equitable and fair and safe access, and less on conservation, that we ended up in the same, with these problems that we have today of increasing trends in pan-drug resistance and the increasing burdens of AMR. And now, of course, I think we're slowly changing the perspective, but still, if you look at the funding going towards AMR research, is still the far majority is targeted towards innovation. So our approach to sustainable development at the Stockholm Resilience Center is quite different. It takes a more embedded approach, and based on the observation that their society has evolved from the environment. There is no society if there is no suitable environmental conditions, and there's no point in having an economy if we don't have a society that is well functioning, and the economy is based on that society. So we take this embedded approach to sustainable development, and that's very much the approach I take to antimicrobial resistance in my work. So if we then focus on the major political agenda of the Sustainable Development Goals, how does that square with that? Well, of course, you have environmental, social, and economic goals for sustainable development, but there's no real, you could say, hierarchy or ontology here with those goals. They are kind of equally important as they are presented in the SDG agenda. So we try to then transform the SDGs into our way of viewing the world, this embedded view of the world, and then of course you see that, well, if we don't tackle issues like climate change or biodiversity loss or water sustainability, well, it will be very hard to achieve the goals for social equity. And if we don't achieve the goals for social equity, well, who knows if it will be important, or does it really matter then if we have, if we prosper economically. So you can view those sustainable development goals in that same hierarchy, you can say. And that doesn't mean that environment always comes before social sustainability. It means that they have to go hand in hand. And whatever we do to achieve social sustainability or equity has to sort of, fit within the operating space, safe operating space that the environment is giving us. Another, I think, key feature of this new narrative, what we need of this new narrative of AMR as a sustainable development challenge is that we need to view it much more on par with climate change, for example, right? And I think just like climate change, AMR has this characteristic of not only being, an environmental sustainability challenge about microbial stewardship, but it also has the same intergenerational skew. In fact, maybe it has the even more marked intergenerational skew in that it's disproportionately hitting children, as well as, of course, weak and elderly people, but disproportionately hitting children that have not had an influence on changing the composition of the global microbiome that we have today, increasing the proportion of resistant infections. So that intergenerational equity perspective is very much there. And I think we need to focus on that much more in how we communicate the challenge, just like it has been very effective for climate change. So that's a bit about my general perspective on AMR and how it fits within sustainability science, which is sort of the academic background I'm currently coming from. And then I want to give a bit more examples of this living with resistance narrative. And at the Resilience Center, we talk about 3 types of resilience. One of them is sort of persistence, is if you try and maintain status quo. Another is adaptation, if you try and gradually change into something new. And then there's the transformation. So that's the third aspect of resilience, which is when you realize that we need a fundamental change in our approach to a problem. And I think we can very much say that that's the kind of resilience we need to build for AMR. We need a fundamentally different approach than what we've had before. And in this one paper, we tried to identify 3 pillars of that, the narrative that could guide us towards that transformation. So of course, there's the observation that antibiotics are the foundations of modern health systems. We can all agree on that. But I think what's more been missing from the narrative is the environmental component here. So that is that we are, dependent on a global microbiome that we increasingly understand is providing us a lot of benefits, what you could call ecosystem services, both through very intimate interactions with our own gut microbiome, but also in terms of providing other benefits for larger global sustainability. As the global microbiome actually is a major sink for carbon sequestration, for example. So that those 50% of the CO2 that gets taken up in the ocean is likely driven by microorganisms. So we depend on the microbiome both at a personal and a global scale. And then I think the third pillar is the public good, right? It's the common pool resource. So this global microbiome that we need to maintain in a susceptible state, unlike a resistant state, is a common pool resource. Not much unlike the atmosphere that is the main component of the climate challenge. Whenever we emit greenhouse gases, some other people will be affected by those emissions down the road. And I think if we use that same analogy for antibiotic resistance, we have those 3 pillars that we need to build a new narrative. And I call that narrative sort of the transformation to a pro-microbial planet. That doesn't mean that all microorganisms are good, but it means that we actively try and enhance the positive sides of microorganisms everywhere, instead of just blindly thinking that we can control them in a sort of what you call a war on microbes, which I think really characterized the early efforts to combat antibiotic resistance. It was very much this escalatory arms race where one antibiotic was substituted by a new antibiotic when there was resistance to that becoming prevalent. But now there is that window of opportunity, or at least there was that window of opportunity to change into this new narrative when antibiotic resistance was taken up at the highest political level at the UN General Assembly in 2016. So there is still, I think, that window of opportunity, although the pandemic has been a bit of a disruption to that. And windows of opportunity in terms of resilience thinking and transformations are a key feature. You never know when they appear, but the key thing is to be prepared for them. And I think if we had had this more, you could call it a planetary health narrative for dealing with microbial resistance, if we had had that in place a bit before that window of opportunity opened, I think we could have maybe brought AMR high on the political agenda on par with maybe climate change. So then how can we operationalize this, going beyond just talking and talking about narratives? Well, we can partly use a framework that has been used for how we can build resilience of new paradigms in sustainability science. And 3 principles that are key there is that we focus on governing the diversity and redundancy, the connectivity, and the slow variables and feedbacks of the microbiome. And so we tried to look at that in a recent paper, and what does that mean for AMR then? And we identified these three strands of actions that need to be promoted. So to really, you can say, tackle the challenge of the slow variable here. The slow variable is resistance slowly increasing, right, and providing negative feedbacks to us. There's no doubt that we need to reduce misuse, but not only misuse, I think use in general, and substitute that use with other solutions. Not that we just remove use and don't replace it with anything, but replace it with other more sustainable solutions. And for that, we need new mental models and norms. And we need to really diversify our approach. We need new practices, or past practices, and new technologies, both of them. So there are many past practices and new technologies that can be used. And finally, I think the most important challenge is the one of collective action institutions, because as we talked about, the global microbiome is not unlike the atmosphere. There's this high connectivity and increasing connectivity of the global microbiome today. The focus really has to be on collective action institutions. So those are three types of actions and forms of practices that we can promote in this new paradigm to build resilience. And I just want to give a quick example of what those mean in like some examples of what those could be of existing initiatives. So I think fecal microbial transplants, I think, is a good example of a new mental model and norm being instituted as a practice, something that was around for a long time and has been especially in veterinary science, right? But all of a sudden becoming accepted in Western medicine, because we were running into a problem with the new virulent and resistant strains of C. difficile. But what about, could we think what had happened if we had had a more proactive approach to promoting these kind of practices? I think that's really the key, is to be not only acting when we're in that moment of crisis, but being more proactive. And I think the SDGs are really the key framework that we then need to link to reduce misuse and use in general. So reduce the selection pressures on the global microbiome. And we try to identify some strategies for how action on the SDGs can link with antibiotic resistance as well. But that's just the beginning. And this PhD project is very much trying to operationalize that approach and actually do proper science on it. So one other key aspect of resilience that I want to mention comes from the AMR Resilience Project. And it very much has to do with being able to, so it's about the governance system, or a key property of the governance system when we want to build resilience is learning. And so in the AMR Resilience Project, we try to institute that in our own research approach to studying AMR. So we built this online learning platform for learning about interventions and what makes interventions effective. And you can say that in this project, we view interventions as, they are a manifestation of the resilience of the system. Effective interventions are a symptom of a resilient governance system. So that platform is online, and you can there view the different interventions that we're studying in that project. The platform is called AMR Intervene, and it's currently being developed. And this is where this platform will also be used in this current PhD project. And I'll explain now the gap that it fills. So here again, you see, okay, focusing on this principle number 5 on learning and experimentation. How can we better how can we be better at learning about our existing approaches and how they could be improved? Well, I think if we not only let interventions sit out there in the literature, but actually gather them in a you can say learning laboratory that is free to view on the internet, well, I think that will increase knowledge production and uptake, hopefully. That's our vision, at least. So the learning platform currently uses three forms of knowledge. It uses published interventions, lessons learned and practice-based knowledge, and then it also tries to understand effects of ongoing or unpublished interventions. And I'll give three examples of those again very quickly. And again, this new project fits here under C. So that's where we're moving towards. So we built now a data set of around 750 published interventions and studying their characteristics. They are mainly still at a local scale, but we're actually more interested in these larger scale interventions because they're the ones that I think we really need to change the system. You can see they cover a lot of different pathogens, but we've initially focused on understanding E. coli interventions, just because that's one of the more abundant types of interventions. And so you can see that there's not a lot of One Health interventions. That's one key thing to highlight. And I think here is the key takeaway, is that they largely don't address distal drivers. They really focus more on affecting the more immediate causes of antimicrobial use and resistance. So here you can see there are a few red ones. They are the drivers, interventions that target drivers. So we're still in this paradigm where we try and govern the you could say maybe the symptoms of AMR, the very proximate causes, but not the distal or ultimate causes of AMR. I'll skip this just in the interest of time. And that's then, does that also hold for national scale action? So policy actions, where now many countries are taking national action in terms of their national action plans. Are they also just targeting proximate causes of AMR? We're trying to understand at least the effects they have. So national policy action in this study here. So we used the tripartite survey of national policy action and try to analyze its effects on drivers of AMR use, antimicrobial use, antimicrobial resistance, and then you could say an indicator of the exposure to antimicrobial resistance through the drug resistance index. And what we see is that actually the level of reported action by each government is consistently, you could say, associated with less adverse outcomes. So here we analyze the trend in drivers use, resistance, and DRI over 16 years, and associated with the level of stated government action. And we saw a negative correlation with all, so you could say in a positive direction. So that's positive, but we still here, we only included a limited set of drivers, I would say. So that's vaccine coverage, infection prevalence, level of sanitation. But there's a much more complex set of drivers out there. And we didn't include anything in terms of what's happening in the animal sector, because there's not enough monitoring going on there to be able to look at that. So finally, then that is what we want to do with this project, is to better understand these distal drivers. And just quickly introducing the team here. So it's Mats Molkvist, based at UU, then DJ Vernley, based in Geneva, and of course, our star PhD student, Luan, who will actually be doing most of the work here. And I think the SDGs is a very good framework for trying to operationalize distal drivers. And you can see the World Bank is very much moving in that direction. They realize that if we take action on SDGs, well, that can be a major source for tackling AMR in a sustainable way. And they highlight some SDGs that are might be more important than others. And you can also just see in terms of the scale of investment that is currently happening in the SDGs, you can see the potential for that. If SDG actions and interventions become AMR oriented, then there's a major potential for dealing with AMR. So it's currently $1 trillion invested annually in developing countries, and 1 trillion euros invested via EU on SDG action. So it's a lot of money. And so the PhD project has these 4 components. It's first to understand more probably the landscape of distal drivers. So basically mapping out the distal drivers using systematic review. And I think that here we want to move beyond existing approaches to understanding drivers of AMR, which if you, for example, look at Chatterjee 2018, it's very much focused on again, quite proximate causes. So we want to take a more holistic view. Then the next step is to understand the degree to which these distal drivers are addressed in either AMR or SDG national action plans. And here we'll use a subset for 15 countries. And then, is there a conflict between the actions taken to affect the distal driver of AMR in these policy action plans, or are they actually operating in synergy? And here we can we'll use a framework from Måns Nielsen and colleagues at the Stockholm Environment Institute that to try and measure the degree of conflict or synergy. And finally, then we'll come back to that data set I just talked about of these 16-year trends in drivers, use, state, resistance, and drug resistance index, and reanalyze it using information on how countries are addressing distal drivers to see if that can help us better understand. Like, so are countries that take distal drivers more seriously, are they also achieving better outcomes? So that's the big vision. And I think now there's just, yeah, now I've talked for 30 minutes. I know I've gone quickly, but then I want to allow some time for discussion. And I thought that would be maybe a good time to target. So Eva, maybe you can help me moderate if there are any questions.
Yes, thank you so much, Peter. It was a great summary of the background, where does this fit, and a little bit of description of how the project is going to go. Obviously, it's very early on the just basically started. But yeah, we have a question here from Carla, who is another UAC PhD student. She's saying, thank you for a very interesting presentation. This biosphere-based narrative is very, but in business studies is harder to integrate. Do you have suggestions on how a business-based research, for example, focusing on the pharma companies and healthcare providers, can be more biosphere environment oriented?
Yeah, that's a big question. I think it's a really good approach. I think if we talk about pharma companies, I mean, I think at least one way of making drug innovation research more biosphere oriented is thinking about the effects those drugs have on the biosphere, right? And I think we are already maybe moving in that direction. It's not my area of expertise, so others will know better than me. But to my understanding, we are moving away from therapeutics that are having an obvious large selection pressure on the global microbiome, and so we'll have this feedback in terms of resistance or other negative side effects to things that can be maybe applied more in a targeted fashion, or that don't necessarily have these large immediate selection pressures. That's at least, I think, one way of operationalizing it in pharma companies. Healthcare providers, I think I have to think about that one, but it could be that maybe if there are other ones in the crowd that have ideas there, it'd be interesting to hear those as well.
The floor is open, so you just take off your mute mic and then just comment on this. On the meanwhile, you guys can write more questions or put your hands up to take a slot on the Q&A. I have a question for you, Peter. You kind of, in the sake of time, I would like to know how many countries did you have in your original database of interventions, and how did you get this data?
Oh yeah, so I can maybe go back here. Yeah, I skipped over a lot of details just to try and have some time. But so when we look at this study in terms of at the national scale, we are looking at around 150 countries. But as you see here, it varies a lot. Then you don't have complete information for all those countries. We're still not able to analyze trends in use or resistance for a large number of countries is still quite limited because monitoring is just being put into place there. So that's one limitation for sure. Drivers is actually more easy because they are often monitored for other reasons. Yeah, as you see, like sanitation, health workforce, infection prevalence, those things have been monitored for a long time, also as part of the Millennium Development Goals. So that's actually often the least challenging one. But we're working together with the Resistance Map Initiative and the Center for Disease Dynamics, Economics and Policy, and they are supplying the use and resistance data. And of course, they are relying on national public health agencies for that. In part, for the interventions, that's based on published interventions in the literature, and the published interventions are very skewed towards high-income countries. So that's why I actually completely skipped this second source of information we use in the learning platform, which is practice-based knowledge. And Søgaard Jørgensen's postdoc in the project has really been leading a lot of that work, where we use surveys and questionnaires to try and assess, to try and build, to try and gain insights and build, create learning outcomes in the platform about success factors for interventions. So here you can see then some of those results in terms of what are important success factors or obstacles for interventions to be successful. Mm-hmm. And the nice thing about using those approaches is that there it's easier to get a balance in reaching both high-income countries and low and middle-income countries. And one of the insights we have there is that, the obstacles for implementing a good intervention to deal with AMR differ between high and low and middle-income countries. So you might have expected this, but insufficient resources is a much bigger obstacle to successful implementation of interventions in low and middle income countries. As you see here, that's the black bar in the blue box top here. Yeah. And the light gray one is high income countries. So we're gaining an understanding of this as well, just by targeting experts and collecting their responses in the platform as well. So we're using we're using these three types of information, right? Published interventions, lessons learned and practice-based knowledge, which is very much based on questionnaires, and then ongoing interventions, studying those through the national action plans or the tripartite survey of national policy.
It's a very huge international collaborative project, as I can understand, a lot of different key stakeholders.
Yeah, I could give a whole talk on this, but I think this more focused project that on distal drivers will really fill an important gap here, because it's hard to get information on that, both in terms of the tripartite survey of national policy action. There's not much said there about it, and in the published interventions, they often are also focusing on proximal causation. So now we think we really have to dig into the national action plans both for AMR and for the SDGs to understand this.
Mm-hmm.
But the step before that is really creating understanding just of what are distal drivers of AMR. So yeah, that's the step we have to do.
My next question, if nobody has any other question for now, it doesn't seem like, but my next question was, what is limiting targeting these distal drivers? But of course I understand that first you need to know what distal drivers are and which ones are the ones that are important. But maybe if you could just comment on why do you think these distal drivers have not been yet, focused in the
because it's complex. It's really hard to track the effect of an intervention that targets something that goes through a complex causal chain of events on AMR, right? So if you target something like let's say corruption or inequality, for example, right? I think those things are not easy to measure. How does inequality affect AMR? Yeah, you can maybe do it with a cross-comparative analysis, but if you want to understand how it actually affects the levels of AMR in a given place, that's really difficult and it takes a lot of time. So I think that's the main reason we often start by just wanting to understand the proximate causes, and things that take a longer time to monitor and understand and are harder to prove causality, I think are often sort of discarded. So
yeah, and also
I think that's the main reason.
These distal drivers would also have an effect, potential effect, even if so much profound, is also a longer term effect. So also
yeah, exactly.
Really get the causality, as you're saying. Very interesting, Peter. Anybody has any questions for Peter before we sign off for this monthly webinar? I guess not. I think you, Peter, will be at the retreat in the end of the month. So other UAC members that want to converse more about this topic with Peter, he will be available. I think now I say thank you to you. I thank you to all the participants today. I see a lot of our PhD students, which is great to get this bigger perspective on AMR, and all the work counts, both interventions, local, national, transnational, smaller efforts in very specific areas of AMR. But I think seeing it from this holistic perspective is really important, and I'm really happy that you highlight how the narrative through the Sustainable Development Goals could be of extreme help and use in this topic. Thank you so much, Peter, and I hope to see you soon, and see you, all of you, back in our next webinar, which will be first Friday of December. Thank you, everyone.
Thank you.
Bye.
Take care.